Good morning, and welcome to the 17th in our series of special webinars about the challenges North Carolina is facing as we react to COVID-19. I am Pat Cronin with the Institute for Emerging Issues, sitting in for Leslie Boney. Since March, we've been looking at different issues emerging during the pandemic, talking with state and local leaders who are helping figure out our way forward. Today, we have the first in a series of 3 episodes looking at the impact of COVID-19 on early childhood learning. But just as important as exploring the impact of the pandemic, we'll be asking the question, how can we turn this crisis into an opportunity to build something better than what we had before? Indeed, a central question throughout the series will be, what do we need to be doing now so that all kids in North Carolina can thrive in the years to come? Today's episode is going to focus on parenting programs and how they help give children a strong start in the first years of life. On July 30th, we'll look at our childcare system, because if there's one thing that the pandemic has made clear, it's the value of childcare to parents and employers across the country. But as parents go back to work, will they have a place to send their children? And how can we create a childcare system that meets the needs of parents, employers, and those who work in the childcare industry? On August 27th, our final episode will examine child and family mental health. Before the pandemic, there was a growing recognition about the negative impacts of childhood trauma on health and well-being throughout a person's life. Experts now fear that the pandemic has unleashed a new wave of trauma among children and adults alike. Our final episode asks, what has been the impact of the pandemic on child and family mental health? And more importantly, how do we create the system we need to support all children and families long after this crisis is just a bad memory? We hope you'll join us for these broadcasts. And now to today's episode. I want to start with a question whose answer just might surprise you. Why should we care whether all children get a strong start in life? Well, a short answer to that is so they can have a chance to be all they can be in life. A somewhat longer answer, and here I'm cribbing from Harvard University's Center on the Developing Child, is that healthy development in the early years, especially from birth to age 3, provides the building blocks for all sorts of things that we value as a society. These include educational achievement, economic productivity, responsible citizenship, lifelong health, strong communities, and successful parenting of the next generation. You may now be asking, how can so many positive outcomes be linked to the first years of a child's life? And the answer to that question lies in brain science. So bear with me for just 1 second. Brain science tells us that a strong start in life is tied to what happens in the developing brain of each child. In short, brains are built over time from the bottom up. Indeed, as you can see on the screen, the basic architecture of the brain is constructed through an ongoing process that begins before birth and continues into adulthood. Simpler neural connections and skills form first, followed by more complex circuits and skills. In the first few years of life, more than 1 million new neural connections form every second in a baby's brain. And why is that building process important? Well, think about building a house. A strong start in life is equivalent to building a strong foundation for a house. If the foundation is strong, you can build a sturdy house that'll be safe, secure, and last you well into adulthood, serve you well for many, many years. In the same way, building neural connections in the first years of life wires the brain in ways that create the conditions for later success in school and life. So how do you build a strong brain? Good health and a stimulating environment. And that's where parenting education programs come in. We've got 3 guests with us today. Safiyah Jackson with the North Carolina Partnership for Children, Cindy Boger of the Hickory City School System, and LaKeisha Ross-Johnson of Mount Zion Baptist Church and Young People of Integrity. Let me note now that we have to say goodbye to Mrs. Boger at 9:45 so she can lead a parent education training session in her community. Let me also note that during the show, we welcome your questions and comments. please use the chat function in Zoom or comment on our Facebook page. We'll try to get to as many of your questions and comments as we can in the next hour. To start the conversation, let's look at where we're at as a state in terms of giving all children a strong start, and then I'll ask each of our guests to comment on what we've just seen. Let's start with two indicators of health, the first being low birth weight. As you can see on the screen, North Carolina is above the US average, which is not a good thing. More babies are born low birth weight in North Carolina than the rest of the country. Within North Carolina, as you can see, Black babies are born at significantly lower birth weights, almost twice the rate of white and Hispanic babies. Turning to infant mortality, again, North Carolina is above the US average, and within North Carolina, Black and American Indian babies are significantly more likely to die in their first year compared to white and Hispanic babies. What about early learning? If we look at the US as a whole and the relationship between income and early achievement, we see that a learning gap opens up early in a child's life. As you can see, by age 2, poor children are already behind their peers in listening, counting, and other skills essential to literacy. And so by age 5, a typical middle-class child is recognizing many more letters in the alphabet compared to a low-income child. What does that mean in North Carolina? Well, if we look at reading at grade level in kindergarten, Asian and white students are reading at significantly higher levels than their Black, Hispanic, or American Indian classmates. Let's start with you, Ms. Jackson. What do you make of the data that we just saw?
Sure. Good morning, Pat and Cindy, LaKeisha. Happy to be here on this panel with you. When I look at the data, Pat, these data remind us of a long-standing, persistent challenge that exists in our country: racial disparities, where the most marginalized communities, Black and American Indians, tend to fare significantly worse metrics. And that sort of disproportionate outcome is something that I'm hoping in 2020 we can continue to shine more and more lights on, as well as solutions. The hope that I feel when I look at that data, those data, is that there are solutions, research-based solutions that help us think about what we can do to address those disparities. I think of targeted universalism, for example. It's a term that can sound very academic. It's essentially a population level solution, meaning all of those numbers we need to work on improving, but universal strategies with targeted investments in Black communities. So that's what I see. I see a persistent story, but solutions that have been proven to work.
Problems but hope. Good. Mrs. Boger, when you look at that, what are you seeing?
Well, I'm seeing just how impactful a program like Parents as Teachers, as a home visitation parent education program, coming from a school approach, because I'm an educator. Our end goal is for students for school readiness and school success, and of course, our whole motto is parents are their children's first teachers. And really have to get into, even with that infant mortality rate, we start prenatally. And just like you were saying with the data on the brain development, it starts prenatally. And so how impactful it can be as we partner and facilitate and reflect with these families to really help move that needle with getting those numbers as far as school readiness. And the literacy is such a huge part of what we do. And just giving those parents that knowledge. That's really what we're here for, to give them that knowledge and support to help affect those numbers.
Well, I want to return to the specifics of what you're doing in Catawba County in just a moment. But first, let's bring Mrs. Ross-Johnson into the conversation. And what are you seeing in that data?
Well, of course, as Ms. Jackson said, we have positivity and we have hope. one of the things I always like to do is put the numbers into perspective. Of course, we see the percentages, but then we want to see the disparity. You know, what percentage of what percentage are those populations making up of the total population? And I think we have to continue to put those numbers out there and continue to put those numbers into perspective so that people really see the disparity. Even on a graph, it doesn't seem, if it doesn't have the accompanying numbers with it, it's not as impactful, I believe, as it could be. But I believe that there's hope, as long as we continue to put that information out there and that we have people like us who are willing to continue to have those conversations. But I think I'm 100% believer that you've got to continue to put the truth out there, and the data doesn't lie. And so from there, then we've got to start having the conversation about what do we do with this information that we have. And thank you, Pat, for starting that dialogue.
Thank you very much for being with us. So let's talk now about the role of parenting education programs in helping to give kids a strong start in life. So Ms. Jackson, let's go back to you. First, for the benefit of our audience, what do we mean by parenting education programs, and what role are they playing in helping to improve the outcomes that we were just looking at?
Sure. When we say parenting education or home visiting, I think of those terms as one of several universal strategies that I mentioned earlier. We're talking about supporting new moms at the most vulnerable time of their own experience as parents, stepping into a brand new experience, even if it's your second or third time. Each birth, each experience is unique. We're talking about professionals who work alongside parents who are in the home or meet families at community centers or schools, as our co-panelist Cindy is doing later. We're talking about investments in maternal and mental health. We all need support, and parenting education is an opportunity to provide that support in the home and in other places where families are comfortable.
Thank you for that. So just to our audience, I'm using parenting education in a very broad sense. You're already getting an indication that within the business of doing this work, there's actually a distinction made between home visiting and parenting education. I'm collapsing those terms. When I say parenting education, these are programs that happen either in the home or, as Ms. Jackson was just referencing, happening in the community in different locations. So sometimes they're one-on-one and sometimes they're in a group setting, sometimes at home, sometimes at not. So I'm using this in a big umbrella sense to encompass both of those. So very good. And so, Ms. Jackson, these are about health of the child and the mother, and then also about parenting skills as well, correct?
Yes, correct.
Great. Well,
And
I'm sorry, go ahead.
I was just going to say the slide that was up a few minutes ago. We can go into that slide or we can come back.
Okay. Was there something specific you wanted to address on there?
Well, I just wanted to speak specifically to the fact that the parenting education programs as a population level solution to the data you presented earlier really creates a trifecta of benefits, that not just the child benefits and the parent, but there's one piece that I wanted to highlight in the interactions between the parent and the child. We talk about brain development. Equally is the establishment of early bonds. So I just want to sort of complete that picture and really highlight how important the bonds and the attachment between the parent and the child are. And also really just have to recognize for a moment the responsive frontline heroines that are doing this work every day, that are learning families, building relationships, and meeting their needs in very specific ways. So thank you to all the home visitors and home educators across the state. This is a really critical priority that we should be investing in. And unfortunately, too many people, too many families don't have access to it.
Thank you for that. And I think that's a good segue. I think Mrs. Boger, Ms. Jackson was speaking about you and your colleagues out there doing this work in communities. Please give us an overview of the programs being offered in your area. What are they focused on, and who's being served?
Well, we are very fortunate in Catawba County because we have 3 programs that are using the Parents as Teachers curriculum. We have an early Head Start. We have the school system one as well. Well, they're actually all school system based, and then we have Counsel on Adolescence, which is a primarily teen parenting program, still using the same curriculum. And just like Ms. Jackson said, it's all about building those relationships. And we have 3 areas of emphasis on when we go on a personal visit, and that parent-child interaction that she spoke to is one of those 3 areas. And so that's where we bring in that importance of play and interacting with your child and the whole family. It's not even just mother and child. It's the whole family working together. We're looking at building on those strengths in those families, as well as giving them those protective factors. And especially, and I know we're going to talk more about COVID a little bit later, but during this time of the pandemic, helping them with concrete support in times of need, even making social connections in a virtual way, because folks are even more isolated now than ever, and just giving them that support, whatever support, and letting them know resources, because that's a big part of what we do is sharing those resources. The other big piece is the development-centered parenting, and that speaks to the mental health of the child, the physical health of the child, issues in discipline, transitions like potty training and sleep. You mentioned something earlier. One of the data points was child mortality rate. So, we talk about SIDS and all of that. I mean, it's just so many things that we cover with these families, but it starts with that relationship, building those relationships. And then once we have that, it's wide open with those families. And we've got a really high retention rate with this program. So technically, of course, those first 3 years are critical, but our program is set up to go until they go to kindergarten. So if we start prenatally until they turn 5, that's a possibly almost 6-year span with the family to provide this critical education and support.
Say more about the child-parent interactions, because I think that speaks to the brain science, doesn't it?
Mm-hmm. It does. And so really sharing with the families the importance of language and literacy, how many words they hear and how that impacts that brain development, and just teaching them even in a way that is, not a level that they can understand in their, I guess you would say, not doctor speak, but in people speak. I heard something just recently, and I thought this was so clear. Like, for example, when a toddler is beginning to learn to climb and they want to climb on everything, that's that pathway in their brain telling them, I need to learn how to climb. So it's like thinking about when you go for a walk, when you go on a trail and that trail is back and forth so many times people are on it, that pathway becomes, the grass is worn out and it's a path. That's so easy to share with a parent. That's what that child is doing when they're learning how to climb. They're creating that pathway in their brain that's telling them it's time to learn how to climb. So that's just, we can give them real examples and real things that they can do to impact when they're learning those critical skills.
Right. And this isn't necessarily intuitive to people, new parents, correct? Because the baby's not talking. And so when you're saying, hey, you should be talking to your child, and the child's not talking back, that may not seem intuitive.
Right.
Speak to that point just a moment.
So we have lots of information to share with families about milestones and when it's appropriate. And that ties into discipline, especially because letting parents know what a child is capable of doing, and that helping them with their expectations and sharing those milestones with them. And that also brings up another parent education program that we offer in many places in North Carolina is the Triple P. And so that is a real supportive in promoting child's social, emotional, and their developmental strengths, and also just supporting parents in understanding what's expected, what's appropriate, and how they can, giving them the tools that they can be effective. And it builds into that self-efficacy as a parent. That's really what we're all about, is parents are the number one first teacher. That's our motto. So we want them to feel that confidence in their parenting skills. And that's part of that self-efficacy theory that we work towards.
Right. And so speak more about the benefits that you're seeing in your work in Catawba County through these programs. What differences are they making?
We are mostly seeing benefits in school readiness. Our children that we track the data, and we do these screenings with our children, the yearly screenings, the developmental screenings. But also just with even though yes, that's very important. But then the parents having that confidence, like I said earlier, that's helping them when they have more bursts. And it's also helping within families, it's spreading out where they can share that information amongst their other family members and friends and become leaders.
I want to come back to you about the impact of COVID on your programming, but first let's bring Mrs. Ross-Johnson into this, because you participated in one of these programs when you became pregnant with your first child, and in fact, Mrs. Boger was your teacher there in Hickory. Please tell us about your program, what you learned, and the impact that it had on you.
And you don't have to tell them anything about how old I am, LaKeisha.
Well, I was going to preface and say you started your career early. You were 12. You were 12. But in all fairness, Cindy, it was within the first 2 years of the program starting, right?
Mm-hmm. I think it was.
When I was a participant. But yes, I became pregnant the beginning of my junior year in high school. And, for I was a very active student, Beta Club and a lot of different honor societies. And then here I pop up pregnant, and I'm the daughter of a pastor. So there was a lot of things that kind of made that situation uncomfortable for me. And so to have a place that I could go to and have a judge-free zone and somebody that would walk me through that process was super helpful. I can't ever thank Cindy enough for being there. And this program has really, at this point, it's been full circle. Of course, now that I've had this now 15-year, no, 19-year, 18, 20-year, oh my gosh, 20-year relationship with Cindy. And, so now I have a 20-year-old daughter who's in college, and, it's like life has gone full circle. I'm now a board member of the Partnership for Children in Hickory in Catawba County. But having this, I think Cindy was speaking on earlier about milestones. I'm one of those people who are always wondering, am I reaching the goal? And so, especially with my child as she grew, being able to have like the little worksheets and things that tell you things you should look for. And, if they haven't met this little thing yet, it's okay. But as long as they reach it by this time, just to have that reassurance that, okay, everything's okay. They may not get there at this point, but as long as they reach it by this point, we're all good. Just those reassuring things as a parent, as a young parent, was very reassuring. Then as a student, to be able to have someone who was holding you accountable for continuing to get your education, and then having peers who may be going through similar things as you're going through was just amazing. And then as I went to college and still had my daughter with me, I still had support. I still had the home visits, and I could talk about. I feel overloaded. I'm trying to do my homework, and she's super active, and I'm trying to keep her occupied. What can I do to have some time so that we can both do what we want to do? She wants to play, and I need to do my work. So to have someone there to kind of walk me through those points in time was just super helpful as a single mom and as a college student. So I can't say enough about parents as teachers.
So
Absolutely amazing.
thank you for sharing that. I'll let the audience know that you now have a 4-year-old as well. And I'm curious, what are the things that you're doing with that 4-year-old that you learned to do with your first child?
So I did not, Pat. I told you I was going to bring my book, but I'm actually spent the night with my sorority sister, who happens to be an obstetrician. So we were having this conversation last night over dinner about early childhood development. But it's funny. I did show Cindy. I still have my notebook from 20 years ago of the different activities. And I remember, as the oldest was a child, we talked about the color recognition. And I remember when Riley was born, I was like, okay, these are the colors that she can see. So we're going to make sure that we have these colors around her in her bedroom, on her mobile, and things like that. So it was like second nature the second time around. Then, the milestones again, just, it felt like, Cindy talked about walking that path as a child. I've already walked that path. And so, but I walked it with someone holding my hand. So this time, going back down that path, I was very confident. Even though it was 16, 15 years later, I was very confident in walking that path again. And I knew I still could call on the Partnership for Children. There's resources available all the time, 24/7. I have a website I can go to. I have people that I can call. So no matter what, I still have the support that I need. So it's very much the same.
So quickly back to you, Mrs. Boger. How typical is Mrs. Ross-Johnson's experience in amongst the students and others that you work with, the families?
I think it's pretty typical. I do think we've seen a decrease in our teen parent rate over the last 15 or 20 years. I'm very proud of her for keeping her notebook, because I always wonder if people just throw those things in the trash. So I'm so proud of her. It speaks to the integrity and the kind of the character of her person, who she is. And honestly, since LaKeisha was in the program, funding and things have changed, and she would not have qualified for our services with her second child. But I don't think she really needed me anymore. She's got it. She didn't need us. But that we are still pretty much providing the same services for teen parents and other parents. It's not just teen parents, but new parents and parents who need that support.
Ms. Jackson, let's go back to you. You've heard a very personal story of success, and Mrs. Boger talking about how that seems to be fairly typical of what's happening in Catawba County. If we look statewide, are we seeing similarly positive results?
Yes. The intervention, the solution of parenting education has a long history of proving results for families. So in Catawba County and many counties across the state and many states across the country, we tend to see very positive outcomes in terms of parenting education, parenting knowledge, support, and parenting skills. Those tools, those connections have been proven for a long time and continue to prove that it is an effective way to support young children and their caregivers.
Great. And I'm going to just crib from the North Carolina Early Education Coalition, where they talk about the benefits of parenting education programs, and again, umbrella term. As you mentioned, strengthening the relationship between parents and children, increasing parenting skills, as we heard, from Mrs. Ross-Johnson, improving parent and child health outcomes, because health well visits are a part of those programs often. Increasing parents' social networks and parent mental health, as we heard. Increasing school readiness. And here's something that people may not be aware of, but this is a worthwhile economic investment. Every dollar invested in a high quality parenting program saves us all between $1.80 and $10 in spending on costly social programs later in life. Things related to child abuse, poor academic performance, unemployment, poverty, and crime. So if we can get it right on the front end, we can save ourselves a lot of heartache and expense down the road there. Mrs. Boger, I know we've got you for, I guess, about 15 more minutes. And before we go, I would love for you to tell us what has been the impact of COVID in the delivery of these programs, including the at-home ones in particular. My guess is it's been an important disruption.
It has, but I'm really proud of my coworkers and my team, as well as the National Center. We began immediately the week following the shutdown. We began doing virtual visits, and yes, it was out of our comfort zone, but we just stepped up to the challenge and quickly learned various different platforms. Our Latino families were really best to communicate. They wanted us to communicate through the WhatsApp. So we've used FaceTime, we've used Zoom and Google Meets, and anything really that we can use to reach out to those families. We've also, because group connections is a big part of the Parents as Teachers model, and we've provided yoga, stretch and grow classes with the kids, even some mental health support for families in how to handle being home with the kids, really, which is a new, for most of them, their kids were leaving it. Some of their kids were at least going to school or going to daycare or something. So we've been able to reach out to them, mostly virtual, mostly face-to-face, like this, video visits. It's kind of, what's been kind of weird about it too is, one of the things we always try to discourage from, especially children ages 2 and under, is screen time. Now we're asking kids to try to look at us on a screen. But what I've really appreciated about this COVID and the virtual visits is it's really given more power, even more power to the parent, because we're feeding them the activities for the parent-child interaction. And we're not sitting there with them holding their hands. We're saying here, and then they're doing it. And it's given them a lot more of that confidence as parents and that closeness and that interaction that we really want. So that's been a really positive outcome and we did survey our families. We're actually on summer break right now. So we're staying in touch through text and other methods, but we're not doing visits again. We'll pick back up in August. But we had a couple of families who were resistant to it. But for the most part, I would say like 80% of our families stayed connected with us and continued to do the virtual visits.
What about we've all heard about the digital divide, and having to all of a sudden go to universal schooling from home has really exposed how some people have access to this kind of technology that we're using right now and other people do not. And I'm just wondering, are you finding parents who don't have access to this kind of technology, and how are you engaging them?
Our school system is supporting us with those hotspots and help with those access. But like I said, once we were given permission to use any platform, that opened things up. And even we can do a telephone visit. So everybody's at least able to use their smartphones to do a telephone, just, conversation on the phone. That is not ideal. And we pretty much were able to get everybody on virtually. But I think it's going forward into the fall. If this continues, we'll probably be looking at some more resources to support families for the virtual visits.
Okay.
Another thing we ran into was the families not having the materials at home to do the activities. So we were doing some of us were doing some packet drop-offs, just basic materials. That's then we found that really surprised us, I guess. A lot of the families just don't even have, crayons and paper and glue, just basic kinds of things. So we had to get real creative about how to do those activities without those materials.
So you had to do all of this in a very short period of time. No,
Very.
few people saw this coming, and all of a sudden, all of our lives were turned upside down. So kudos to you and your team for figuring that out quickly. There's a question in the chat relating to the question of how easy or hard is it to access the parenting programs, and we'll just take Catawba County as an example. And I think this will be a nice segue into looking at the work ahead.
So as far as accessing services, is that what you mean?
Yeah, how easy or hard is it for a new expectant mom, for instance, like Mrs. Ross-Johnson was, to access your services?
Well, like LaKeisha said, our partnership, we provide so many resources here. It's just really a matter of calling up and getting your referral in with us. We do work very closely with the hospital, and lots of new baby referrals come our way every week or in my box. And with of course, with our school systems and our Department of Social Services. So we also have social media. So I think it's pretty easy to find out about our program and to get at least on the waiting list. If we don't have room, we get you on the waiting list and get you connected in some way with another program if need be.
Okay, so a waiting list implies that you're not able to really engage everyone that has reached out to you. And so let me, before you disappear on us and go off to your training session, let's look ahead to a post-COVID world, or at least a world in which there's a vaccine so we can all go about our daily lives as we used to. If parenting education programs in your area are generating such great results, what is needed to have a bigger impact within your own county? What's not happening now that needs to happen?
Just really more funding. We would love to be able to fund more parent educators, more triple P programs. We have a big dream that we've been working on for about a year and a half to start play groups, in particularly where the areas of disparity are in our county. And that would be, a play group would be another way to segue into the Parents as Teachers program. But while they're on the waiting list, we could serve those families. And again, we need the money, we need the resources. It's always about funding. So we used to have 10 parent educators and we now have 5, but that doesn't count the early Head Start programs. They do have 10 in their program. So we always just need more personnel. And then,
Sounds like there's a real mix of different programs and different funding streams associated with each, and they kind of come and go. Is there no regularity to that? Or
well, the early Head Start is is federally funded, as you know, and then our program is school system and mostly Smart Start funded, and then the other one is by the state. The Teen Parent program is funded by the state. So
okay.
it'd be nice if we could put all of our pots of money together, I guess.
All right. Well, I think that's a cue for Ms. Jackson to come back into this conversation. And Ms. Jackson, you and the North Carolina Partnership for Children are involved in a statewide effort, ongoing, begun last year, I believe, to examine the question of how to strengthen parenting education programs in our state. Why was this effort started, and what do you hope to accomplish?
Sure. The effort was started because just anecdotally, we hear stories of wait lists and not enough access, as Cindy describes. But in a very concrete, data-driven way, the Jordan School of Social Work, about 3 years ago, produced a landscape analysis and study of home visiting and parenting education programs in North Carolina. And it validated what we knew intuitively. Too few families have access. That report suggests that only about 1% of families who could benefit actually have an open, available spot for them to access.
Can I actually just stop you at this point and see if we can pull up one of those maps that I had pre-prepared? I think they come directly from that survey that you were talking about. So this, again, thanks to the North Carolina Early Education Coalition for pulling from that report. But what you're seeing there at a county level are the percentage of families with children 0 to 3 served by home visiting programs. And you can see in the light yellow, less than 1% are counties where less than 1% of those families are being served. And it ranges all the way up to 15 to 20%, which is in Guilford County only. 11 counties have no home visiting programs whatsoever. The unmet need is especially high in rural areas and inconsistent in urban ones. And as you said, overall, a very, very small percentage of families are being served there. So I'm sorry, I didn't mean to stop you there, but clearly access is a motivator. Tell us about the effort that you're involved in.
Absolutely. So the lack of access is one challenge that we were addressing. The other challenge is what you and Cindy briefly referenced, and that is the range of options that families have access to. There are many different types of parenting education programs that happen in the home. There are many others that happen in other spaces. And in order to expand access and to provide effective choice for families, there was a need to also think about how do we align these programs in a way that provides a seamless opportunity for families to engage in. Within each of those colored counties, if you cross one state line, you may have access to one program versus not another. And we want to make sure that all families have access to the kind of parenting education curriculum that is responsive to their needs, because they're not, the experience of the home visiting varies by programs, even though they're all working to similar goals. So we started last year an effort to develop what we call a state system building plan. We are trying to take all the various moving parts within home visiting, from the funding to the professionals that do this work on the front line, to the measurement of outcomes, and really look at it as one intervention that needs significant scaling within the state of North Carolina. So the state action plan provides a roadmap that helps us think about what are the outcomes and the goals that we should be working toward as a state if we really want to expand parenting education as a universal solution that all families, any county, can benefit from.
I'm going to interrupt you just to say goodbye to Mrs. Boger, who needs to go off and do her,
train the trainers
program. Thank
Yep.
you so much for
you.
being with us and sharing your experiences.
Thank you for having me. I really enjoyed it.
Our pleasure. Again, thank you. And we have a second map. If we could bring that up, that speaks to your last point about the range of options, Ms. Jackson. As you said, not all parenting education programs are the same. They're designed to do different things, to meet different types of needs. And here's a map that also from that landscape study of the numbers of parenting education programs. Again, this is one of the buckets that big umbrella that I was using under parenting education. So the counties in white only have what has been referred to as the triple P parenting program. Those counties in green have got 2 programs, and those in blue have got more than 2. And is it correct to infer from what you're saying is the ideal state is to have every county with certainly more than 1, probably more than 2?
Yes. Yes. And for the audience, I think this an important point to note between the 2 maps that you showed is that the first map looks at parenting education that happens in the home. And this map looks at parenting education that happens outside of the home. So that explains some of the color discrepancy across the state. But in the end, it is part of the state action plan to increase access, to increase alignment, and to ensure that, yes, within each county, families have an opportunity for 2 or more programs.
Can you just give us briefly, how did this kind of patchwork quilt um, situation arise in which some counties have more than other counties, some counties have none?
Sure. Well, like so many things in the nonprofit sector, it's driven by funding. It's not at all for the hard work of our local partnerships across the state who are advocating and working on behalf of children. The patchwork of funding from federal to state to local dollars really drives the opportunities, and it is the underlying factor for the inequities that persist in our country and in our state. More well-resourced um, counties, um, those with yeah, more resources and more staff and more capacity tend to be the first to get those investments of home visiting and parenting education programs. And thinking back to the opening when you presented the data, I say again, it is something that all parents benefit from, that all children and all caregiver child relationships benefit from. So we need to see universal, every county more than one. But we can't forget the importance of targeted investments. So as we are working toward these universal goals, there is a need to look at the racial distribution of families across the state and ensure, like the first map you shared, that a lot of our counties on the east coast of the state and all throughout, that there are specific targeted solutions that benefit families and that are responsive to the unique needs of Black and American Indian families.
Can you take a moment and describe the world we will have when your plan comes to fruition? What's going to be different and better?
Well, simply put, we'll have more Mrs. Cindy Bogers and we'll have more LaKeisha Ross-Johnsons. We'll have a workforce of parent educators who are equipped with the skills and resources to be responsive to their families. We'll have little to no barriers for families. You get pregnant, you see your obstetrician, you're connected with a home educator, a home or parent educator. And in the long term, I mean, we would have more parents like LaKeisha Ross-Johnson who says, I walked this path first. And the second time around, I was more equipped. So I get excited about a time where we can, as a country, as a state, we can see that investments in child and maternal health, physical and mental health, as well as those positive interactions. So access, good quality, and equity is
And
our,
of course, if we do that, then we're going to start to see some numbers coming down on that we started with, right? The health and educational outcomes.
yes, yes. Yes, because we can, at the federal level, at the state, within Smart Start, when we analyze our numbers and our impact, we continue to see positive, 80 to 90% of families and children reporting better health. Well, the children aren't reporting, but the measures suggest that those things are happening.
So let's look to the future and making your plan a reality. Where is it going? What's the timeline? And importantly, what's needed to make it a reality?
Oh, yes. Well, the first thing that's needed is a commitment from a range of state and nonprofit organizations, and we have that. In order to produce the state action plan, North Carolina Partnership for Children worked alongside many of our local partnerships at the county level and many of our birth to five serving state agency peers. So we've got a commitment to this work, a sense of collaboration across agencies that can make it work. But there's always, what do we need after that? And that is investments. We need more federal, state, and local investments to fund these ideas. And, it sounds Sometimes I hate giving that answer, but that's literally, we need the resources to be able to put these great ideas into place. One other thing that I want to point out that's really critical is I think that while we're working to secure additional resources, I think it's really important that we try to destigmatize parent education. We try to normalize help. These aren't programs for only the vulnerable, only the lower resourced communities or lower resourced families. We need to be able to normalize mental health services and support services. So I believe that that is something that without funding, we can begin to have more Zoom casts like this, more journalists telling the stories, more communities and all of us really talking about this in a way that creates momentum that matches the funding.
Great. Well, thank you. And speaking from personal experience, and again, I've got a 20-year-old like Mrs. Ross-Johnson, and when he was born in, this was Arizona, we were given a binder of material in the hospital. Didn't expect it, but it was a whole host of resources related to parenting. But I think destigmatizing seeking help is really important, because I can tell you there were nights, usually around 1:30 or 2 in the morning, when you were sitting up with an unhappy baby and trying to figure out what the heck is going on and what am I not getting right, and feeling like a total failure. So, so I think we've all had those moments, and I think you're right. Destigmatizing and providing ways to build support networks is so important. Mrs. Ross-Johnson, let's bring you back in. I want you to wear your hat as a member of the board of the Catawba County Partnership for Children. I don't believe you're directly involved in the effort that Ms. Jackson was just describing, but how does that sound to you, given where you're sitting in the western part of the state?
Well, actually, I am a part of the Parent Engagement and Leadership Coalition for the state, and am on the accelerator team. So we do have passings throughout the month.
So you do
but
cross
I,
paths regularly through that program. Yep.
yeah, but I was waiting for you to give me that opportunity, because, of course, I am a fundraiser by profession and a musician. But one of the things that we are looking at as a board is the investment and the ROI, their return on the investment for people who give privately, for corporations and foundations who want to invest into something like this. Now we're starting to see the data on children who have been a part of programs since their early childhood, and now that they're matriculating through elementary school, and how they are performing. We know that this works, and so for a person who wants to see their communities flourish in the future, for a person who wants to see their state and their country flourish, and for people who feel like they don't want to have a system of dependent citizens, then now is the time to invest in programs like this. Because unless you invest into that seed can't grow into a flower, that seed can't grow into a tree, and then that seed can't provide the shade that's needed for the future generations. So now is the time to start investing, and you're going to see a return on your investment. Pat, you gave those statistics earlier. When you invest now, you are keeping us from having to pay the price later. And when we look at third grade reading levels, we are looking at what is the prison system going to look like. And so why not invest in that pre third graders cognitive, social needs early on, so that when they get to that point, we don't have to even think about a life like that for that kid. We know that they have the resources and tools to be successful, and that they can be a contributor and not a menace to our society. So we've got to invest. It doesn't happen. It just doesn't happen. We've got to start taking initiative. And those of us that have, and those of us that have the capability, who much is given, much is required. We can't just sit on the things that we have and not give it as a gift. And that's why I am so passionate, because I know that somebody invested in me when it seemed like I was just a statistic. I was a pregnant teen, another pregnant teen who, had unprotected sex and got pregnant out of wedlock. Who wants to take time to invest in that kind of statistic? But luckily somebody did. And because they did, now I'm able to work on the board and to make sure that we continue to support people. And I'm able to be a contributing citizen in my community. So it is worth the investment, even if there is just one out of that group that is able to climb up and say, I'm going to help make a difference. Each one reach one. And then as they continue to reach another one and another one and another one, it begins to multiply. So it's not in vain, even if you can only reach one. So I just encourage everyone to just step up and just start to just see what first step can you take. We need the money. You can't do anything without money. And so yes, we need to start looking towards private investment, corporate investment, and it's not a bad investment for those who are in that lane.
Well, we have come to the end of our time, and I was going to ask each of you, give you an opportunity to say something that hadn't been said. And Mrs. Ross-Johnson, I think you may have just said it all right there. And so I'm a little leery to ask Miss Jackson if she wants to follow that, because that was a very eloquent statement that you just gave. But first, Miss Ross-Johnson, is there anything further that you'd like to say before we close?
No, just thanks so much, Pat, for having these conversations, and thanks to everyone who's joined. I just challenge everyone who's on this today to just begin to set that goal. And what are you going to do to be the change you wish to see in the world?
Well said. Ms. Jackson?
Yes, two things. Well, thank you for hosting this conversation. I hope it will spark many more conversations across the state. One thing that we can celebrate as a state in terms of new investments is that in December 2019, North Carolina received federal funds under the Preschool Development Grant to invest in expanding universal home visiting. So over the course of the next 3 years, the Department of Health and Human Services, the Smart Start Network, and our partners across the state will be specifically working with federal funds to increase the percent of families who have access. So that is something very exciting that I encourage all listeners and those who care about expansion of parenting education to follow that journey. And my last thing is, thank you for being here. Let's keep talking about parenting education. Let's normalize that this is a universal opportunity to invest in young children. Thank you.
Wonderfully said, and thank you both for helping us end on a positive note. That's our show for today. And as we close, let me note that we are committed as an organization to engaging a diverse and representative audience in our work across the state. And so we would be very grateful if you could take 1 minute to fill out a very short 5 multiple choice question survey to capture audience demographics. You'll find a link to the survey in the chat box if you're watching on Zoom, or find it posted on our Facebook page if you've come in through Facebook Live. Our thanks again to today's guests, Cindy Boger with Hickory City Schools, Safiyah Jackson with the North Carolina Partnership for Children, and LaKeisha Ross-Johnson with Mount Zion Baptist Church and Young People of Integrity in Hickory. Join Leslie Boney for a special edition of First and Future on Tuesday. That's right, Tuesday, not Thursday, July 28th It will feature Justice Anita Earls and Attorney General Josh Stein talking about racial equity in criminal justice. I'll be back in 2 weeks for the second in our series on early childhood learning. Please join me on July 30th for a conversation focused on our early care system, our child care system. Our thanks to the Duke Endowment for sponsoring this series. If you enjoyed today's show and you're interested in sharing this episode, please check out our website, emergingissues.org, where we will post both our podcast and Zoom recordings by noon tomorrow. You'll also be able to find our slides as well as links to supporting resources. Again, that's emergingissues.org. First in Future is produced by Greg Hedgepath and James Herrick. Kirsten Chang gets the word out and keeps our chat going. Simone Coleman does our research. My thanks to all of them. And to all of you, stay safe and see you in the future.